Members, we have attained the quorum. It's about time to get started. So we invite the deputations in, please. Shall we invite the deputations in quick, please? Good morning. Welcome, deputations, and also the carers associations and the administration. We are here today to discuss the long-term care, the support services for the carers. The CS, Mrs. Carrie Lam, said earlier on that the Commission on Poverty is contemplating the idea of some kind of subsidy for the carers, and this is mentioned in the government's documents. Now, as far as the carers are concerned, we're not simply talking about the elderly. The people with disabilities also require caring, and I understand that there is ample room for improvement as far as the carers service is concerned. The cash assistance is also lacking. I'm really pleased to say that we have 54 deputations and individuals who have joined us to express their views. We have very limited time, and it is a long day for the administration. We're going to spend 3.5 hours on today's public hearing. We will take a break sometime this morning. Now each deputation will be given 3 minutes because any longer than that means that we will be here for more than 4 hours. And we'd like to leave a little bit more time for some exchanges with the administration. First of all, I'd like to invite the administration to take us through the paper. Mrs. Chen, please. Chairman, members, I know we are pressed for time. Let me say something briefly. Aging in place represents our key policy. This is the aspirations of the elderly people. Now, other than providing community support, the carers would play an important role. Your support would mean a great deal. So in terms of carer support, we have two different categories. The first one is to empower the carers. Through the district elderly community centers, the neighborhood centers, and the home help teams, we provide training and information to the carers to equip them with the knowledge about the illnesses of the senior citizens, the communication skills, and so on. And that would enable them to do the job a little bit better. Second, we fully understand that it is very stressful to look after senior citizens on a long-term basis. We'd like to offer some support. We do have counseling. We do have the self-help groups, hoping that they would build up some social networks for communication, for mutual support and encouragement. Of course, given the existing community services, we have the district community service, we have the home help service. We also have the services for the post-discharge elderly people. We have this integrated post-discharge service, and also the respite day services. All these are intended to provide some short-term relief for the carers. For the senior citizens who are financially worse off, we do have the safety net under the CSSA. Other than the monthly standard rate, which is higher than an able-bodied person, we also have the special grants and supplements, hoping that the carers would have some relief financially and so on in caring for the elderly. Finally, the subsidy for the carers. As the chairman said a moment ago, the chief secretary did say that under the Commission on Poverty, under the CCF task force, they will consider the idea of a pilot for subsidies for the carers. As far as the government is concerned, we believe that this is an idea that can be explored, because this ties in with the direction of aging in place. But this is only at a very preliminary stage. As regards the details and timetable, we haven't got any finalized idea yet, so I'm really delighted to be here to listen to what the deputations have to say and members have to say, and we will make reference to these when formulating the policies. Commissioner. Chairman, for the PWDs, now policy-wise, the PWD should be able to choose to live in the community. So it is our objective to provide them with enough community support and care. There are two parts to that, all for the PWDs. We hope that we can empower them to be integrated into the community. The other part is for the carers. We like to enhance their ability and to relieve their burden. There are two parts. The first one is community support service. The other one is financial support. Community support, as members are aware, at the rehabilitation centers, and we provide all the support for the PWDs. We also have the home help service for the PWDs in order to relieve the burden on the carers. Now, this home health service for people with severe disabilities is being implemented in 4 districts. As indicated in the policy address, in March 2014, we're going to be regularizing this particular program. We'll extend this to all over Hong Kong. And this will be extended to those who are not on the waiting list for a home. We will enhance this particular area. The other thing is the respite service that would be also needed. Financial support, as members are aware, under the CSSA, the standard rate is higher than others. We also have the special grants and supplements. If there is medical certification that there is a need for constant care, then the disabled can hire carers and get subsidized for that. We also have a disability allowance under the CSSA. We are aware that there are some low-income people who are not within the CSSA in that who also have the need. So under the CCF, we have the $2,000 subsidy for the disabled. If they do need to have medical equipment like respiratory support, they will have additional subsidy. So the SWD is working together with the HA in order to make these programs regular, so that those on low income but not within the CSSA net will also get supported. We attach a great deal of importance to the self-help groups. The SWD at the present moment has a plan to support these groups on a regular basis. So we would like to listen to what the deputations have to say in this regard and make improvements as we go forward. Okay, thanks very much. Let's move on to the deputations. Well, I must say that the deputations will not be protected by the powers and privileges ordinance. Each deputation will be given 3 minutes. The first one is Mr. Lee.
Respite accommodation service for parents who are unable to take care of their children. The respite accommodation service is a choice for them. According to the administration, the respite service will be cancelled in March 2014. But we have not heard any updates from the administration. And how does the administration respond to the demand? And for children under 15 years of age, there's also great demand for the respite service. And 1/3 of the hostels do not will cease to serve these children. A lot of care homes refuse to provide service to these patients because of a lack of resources. A lot of parents have to make ends meet while taking care of their children. The government should give them greater support to relieve the economic pressure from the parents and carers. At the moment, most of the support services are provided within office hours, and there's a lack of support outside of these hours. In terms of daycare services, in effect, there's not enough support for these carers and parents. There are not enough facilities, and then the fees tend to be quite high. and the waiting time for these services is very long. The government will always talk about family harmony. And the carers are often exhausted and distressed from taking care of their family members. The government should review the policies and review their strategies, and we cannot accept any more delays. Hong Kong Association of Gerontology, Mrs. Chung. We are very concerned about the situation of carers. In 2009, we set up a support center for carers in Hong Kong. In the last 4 years, we have been in contact with over 1,000 carers, and we have a few suggestions about the policy on carers in Hong Kong. At the moment, the measures are very generic, and they cannot help specific carers. Right now, we only have 11 elderly homes that can provide respite service. The government said that all subsidized elderly homes can provide these beds, but in effect, very few people can enjoy the service. The opening hours of daytime care centers are very short, and they are not even open during weekends and holidays. And a lot of these, very few of these respite providers provide transportation for the elderly. And a lot of carers are forced to give up their jobs, and this affects their income directly. And a lot of carers are under great financial pressure because they cannot enjoy a lot of services because of the economic burden. And this would affect the standard of care afforded to the elderly. And we have the following suggestions. First, we should expand the opening hours of the daytime care and respite providers, and we can have them open during the weekends and holidays. A lot of the elderly people cannot leave home, and it's very hard for them to use a lot of services. So can we provide outpatient services and to help relieve the negative emotions of the carers and relieve their burden? And we should streamline their application procedures so that more elderly people can enjoy services. Thank you, Mrs. Chang. Hong Kong Blind Union, Mr. Wong Chun-hang, please. I want to first respond to Mr. Siu's points. He said the government would provide support services to carers. The Hong Kong Blind Union is a self-help organization for the visually handicapped, and Mr. Siu has responded to our pledge. But I want to make a point that for self-help organizations such as ours, we really want to provide such services. We believe the visually handicapped can afford to live independent lives, but due to population aging, for people who suffer from visual diseases in the latter stages of their lives, time is needed for them to adjust to their lives. And at this stage, it's very important for their family members to provide support. I hope the government can put in more resources so we can provide greater support for the carers of the visually handicapped, so that they know how to communicate with their family members, and they know how to make their homes more accommodating for their visually handicapped family members, and to help the visually handicapped to enjoy more social services. Greater financial assistance or subsidies are needed for the carers. A lot of the visually handicapped might need to support their families financially, and with the diseases, they might no longer be able to do their jobs, and their family members need to help them accommodate to their new lives at home. And the carers already need to help their fellow members adjust to their new lives, and we do not want to see further burdens be placed on these carers. The administration should extend financial support and subsidies to these persons with visual disabilities, so that they can they can more easily adjust to their new lives. Mrs. Chang Fan from the DAB. For carers of family members with long-term illnesses, they have to give up a lot of things, including their jobs. And the carers, they might be emotionally affected, and they often need to care for their family members around the clock. And in a lot of the cases, their normal social lives are compromised. As we discuss the support for these carers, we need to think about actual financial assistance as well as emotional support for these carers. We know a lot of elderly homes have very long waiting lists, and the waiting times are very long as well. For a lot of carers, this is a great burden for them. Setting up a concrete timetable for these, for those on the waiting list is and will be an encouraging measure. And we should provide more respite service for the carers to give them some breathing space. At the moment, there are inadequacies in respite service, and we need to improve the service quality as well. In some cases, they might attend the activity centers, but there's no guidelines or training provided for them. The training of professionals is very important as well. And we should set a specific ratio on the number of carers to patients. For people who suffer from the Alzheimer's disease, it's not curable, but so we need to take that into consideration. I think, and we can consider paying these carers. And First Step Association, Mrs. Ng. And our targets, our service targets are people with serious physical disabilities. The government should seriously consider giving an assistance to carers. Carers have often take care of their family members around the clock, and I'm very disappointed with the government's suggestions. I've served in the First Step Association for more than 10 years, and back then, over 10 years ago, we have voiced our opinion to the government, and now. And today we're still talking about these social supplement facilities. I hope the government can really review its policy. When we talk about carers, we are talking about people who take care of their family members around the clock, and they have to take care of their meals, bathing, sleeping, taking care of wounds, and they need people to open doors for them, go out, and these are all care services. So we think the government is not providing appropriate services in the right directions. You are supporting the wheelchair users and not the carers. And for all the support services and assistance in 206 and 207, they are only geared towards persons with disabilities and not the members, not the carers. And the carers are even more professional than hospital workers. And for the pilot schemes, and none of these measures are targeted towards carers. And in the UK, there are policies that the carers can receive support. I think you should appreciate the carers' efforts and give them appropriate cash assistance. I think they will be very happy about that, and they will not use it for their own purposes, but instead they will they can do something. They can exercise, or they can hire maids to help relieve their own stress. So I hope you can consider these.
Next, Madam Kwok Lai Sheng. I am a carer. For the sake of my family member, I have to look after him with the daily life. My husband has to attend therapy on 2 occasions a week, and I hope that there would be a couple more days so that I can contemplate my life. I am a senior citizen myself. I would like to put in a request with the administration. Those from the lower rung of the community are not able to look after the expenses incurred in looking after the disabled, and we have to live on the CSSA. And it's only when we're not living with our family members that we would be eligible for the CSSA. And if we live apart from the family members, then we are left unattended. And I urge the administration to consider giving additional choices to the disabled. It is hard enough for the disabled to be confined to the wheelchair, and if the administration can address the problems of the disabled, then it's going to be a win-win situation. Thank you. Thanks very much, Madam Kwok. Ms. Lee Lai Han. Good morning, members, Chairman. I am a carer. My son is physically disabled. He's a young kid. Every single week he has to attend lessons. He wants to be integrated into the community. I am his mom, and I have to be with him. He can't really look after himself, so I have to be with him all the time. He gets a waiver for his transport costs, but I don't. I have to pay the full fare, which is very, very high. And I accompany him everywhere all day long, and it would be a huge burden for the transportation costs. And I hope that the administration will do something for the carers, perhaps offer us some subsidies for the transportation cost. Now we swipe our octopus on our way up to the bus, and we get charged for that, and I mean it's very expensive to get around by public transport. I hope that there would be some kind of a waiver or some subsidy for that matter. And the carers are always out of the loop about public information. We don't have any clue about the services that can be made available to them. If there can be a one-stop hotline available for us to call through, like the places where the disabled can pursue certain studies. If we have a one-stop kind of service, we don't have to be running around all over Hong Kong. This is creating a lot of burden on us. I hope that the honourable members and the Commissioner would spare a thought for the carers. Thank you. Thank you so much. All right. Caretakers Concern Group. Well, it is very much a job to look after the senior citizens. It's like an in-law looking after the mother-in-law. The carers' allowance can be 1/3 of the median wage. According to Census and Statistics Department, the median wage is $12,100 in 2011, and in 2012 it is $12,700. Let's say we're working for 8 hours, and each week are working for 28 hours, and we should be getting about $2,000. And this is half the time that everyone else will be working. As I said, if we are looking, I'm looking after a senior citizen who is wheelchair bound. I mean, the previous speakers have a tougher life than I do, and their expenses are greater than mine. And let me come back to my story. Now, the carers have to shell out the daily expenses, and they have a very heavy financial burden. If they have to go to the doctor for follow-up consultation, they have to catch a taxi. If it is raining or if it is cold, the fruit money is not enough for them to fend for themselves. I think the universal retirement protection should be put in place so that they don't have to worry about their retirement life. And the carers will also get some protection. So as far as the carers allowance is concerned, the carers may be looking after people with different conditions. On the 22nd of August 2011, I mentioned the sliding scale, and I hope that the government should not tar everybody with the same brush. And there are some senior citizens who don't really want to be put in a home, and the government would stall the construction or the provision of elderly homes. Now, the homes cannot be replaced by home help service, and there are some domestic helpers who are hired to look after senior citizens on a 24-hour basis, but sometimes they cannot cope and they have to send the old people to a home because they don't have the right facilities. Right, next we move on to the Salvation Army Carer Association, Ms. Chen Fat Chun. Chairman, thank you. I'm chairperson of the Salvation Army Carer Association. I'd like to make the following suggestions. First, we have to enhance the education for the carers. Depending on the illnesses, we should provide the suitable home care training, like the home visit by nurses. There should be publicity to publicize all the resources available for the carers, and they would then be in a position to get in touch and seek help. Second, we should enhance the community care service, in particular the residential respite service and rehab bus service. Third, there should be tax concession for the carers to benefit. They can be flexi hours and also day offs for the carers. Fourth, for purchase of beds and wheelchairs, the expenses can be deductible against tax. In relation to the carers' allowance, the Salvation Army conducted some opinion poll. We proposed that the government provides the home help carers allowance through an assessment. If an elderly person is assessed to be suffering from certain illness, then through the means test, they should be able to enjoy this kind of service. The basic allowance should be $5,800, adjustable against inflation per annum. For elderly people who are severely impaired, there should be a higher allowance. Second, the carers' allowance. For senior citizens who do have a need, if they're working for 28 hours per week, there should be $2,000 cash allowance as an incentive and as a recognition of their role. And this should be adjustable to inflation. There shouldn't be any means test. So much I have to say thank you very much. Thank you. Right, moving on to Tonghua Group of Hospitals, Lok Kwan District Support Center, Ms. Kwan Chui Peng. Chairman, as the Commissioner said, we have 16 district support centers. We're serving Hong Kong West, the islands, and the Southern District. We cover a vast area, and the problems arising from that mean that the users and the carers are facing tremendous difficulties. The carers are playing a significant role for the PWDs. Now, we're not talking about caring for someone in the twilight years. We're talking about long-term care, 30, 40 years. And they do have medical needs which are lacking. Some may be suffering from muscle spasm or a stroke, and they do need physiotherapy. On the islands, we don't have any headquarters, so physiotherapy and occupational therapy have to travel all the way to the homes of the disabled with their basic equipment. They can't really carry any cumbersome equipment with them to aid their recovery. The carers are facing tremendous pressure, and I'm thinking in the district there are cultural recreational facilities in the community, and there can be some facilities that can be put there for rehabilitation purposes. In the district, in absence of any facilities, there should be some facilities to be made available in the community for rehabilitation purposes. I'm wondering whether some coordination can be made in the district. We are hiring or we are seeking the services for free in the district. Now, there are many disabled people who are very, very young, and they're getting younger by the day, and the caseload is really increasing tremendously. In some districts, the islands, Dongchong, for instance, there are no special schools, no shelter workshop, and no training centers. There are only 2 day training centers with a very small number of places, and the carers have to rely on the district community centers, which are serving a large catchment area. And in the district, there are no social enterprises. The disabled will have to travel all the way to Ap Lei Chau and central and western districts to get a job in the social enterprises. We have 56 members, 43 of them are serving between 18 to 40, and they should be placed in jobs, but there are only 3 that are able to find a job. And for them to look for job opportunities, it would be very difficult because they have to pay for the transport. By our calculation, someone coming out from Dongchong and Pengchao, the carers will have to spend $50, $60 per day for someone earning $9,000 per month. The transport costs incurred would take about 5% off their pay, and this is a huge burden for the family. And I do hope that there would be more facilities to help them.
Thank you, Mrs. Kwan. People who live in remote districts face challenges. With the population aging, the carers face great challenges. And this is a problem which would only get worse. In the rehab policy announced by the government in 2007, training the carers and making them social assets is very important. The carers often face great financial burden, and I think the government ought to encourage these carers or give them assistance, financial assistance. This is something the government should act on as soon as possible. According to the government, right now we have there are 60 teams of domestic helpers supporting a population of over 1 million. So we are seriously understaffed. We are just talking about a basic level of care, and in some cases, the level of care is highly is inhuman. with such a limited labor force supporting a population of over 1 million, it's very obvious that it's not enough. And the government has ignored the support needed by the carers. And the government should consider emergency support for persons with disabilities, because this is the problem faced by many PWDs. In the next 10 years, the government should think about the problem of caring. Today we have 54 groups here. This is a serious issue, an issue about the lives of our people. In the next 10 years will mark the peak of population aging. If we do not handle this problem properly, it will become a political issue for the governments. And the government must tackle this problem as soon as possible and come up with a comprehensive plan. Thank you, Mr. Law. Next up, Grace Parent Association, Mr. Yip Ki-chun. I want to talk about the aging of persons with mental handicaps. Last year, we sent 600 letters, 200 letters to the CE, 200 and the rest to the secretaries. And Mrs. Carrie Lam and Matthew Chung promised to hold a meeting with us, and they sent 8 officials, and we had a delegation of 120 persons. We raised a lot of questions, and we talked about the aging issue for the mentally handicapped. We raised 3 proposals, and they have these mentally handicapped people have very little options but to suffer. And Mr. Matthew Chang has not done anything on this to follow up on this issue. On the 13th of April this year, and the SFH wasn't even aware of the complaints we filed to Mr. Matthew Chang. And in 2003, the government has stopped supporting persons with mild or medium-level mental handicaps. The fact is they need support, and it's impossible for them to visit the doctor by themselves, and the result is their situations have got worse. And even outpatients, psychiatric doctors refuse to take up such cases. A lot of these patients with mental handicaps, they are suffering deeply in their lives, and their parents have to take care for them all year round. Mr. Yip, can you speed up, please? In December 2012, at 12:45 p.m., I was talking with Matthew Chung. My son had a heart attack in the hospital, and he was under rescue. And I made this complaints to the government. And now I'm effectively half blind with eye disease. And I think the government has no conscience. I understand. Thank you, Mr. Yip. I hope the government can really hear what you have said this time. Association of Women with Disabilities, Hong Kong, Ms. Chen Yuk Lam. We are the only self-help organization for women with disabilities, and we also care about the rights of carers. As you may know, it's still the norm in Hong Kong that most women have to take care of their families, and this is the same even for women with disabilities. They still need to take care of their families, and the government's efforts have not been popular with the society, and these women carers face a lot of challenges and difficulties. And we have received voices. We have heard voices from women carers, and they are very worried that their jobs or their sons or daughters would be affected. And some of their kids refuse to go to school because they might be laughed at by their classmates for having a mother with disabilities. And these are some of the intangible pressures faced by these women carers. And in a lot of cases, they focus only on their family members and ignore their own emotional needs. And some women with disabilities have problems visiting wet markets even because of a lack of access-free facilities. So the government should make sure these facilities can cater for women with disabilities. Then they have to ensure that the living quality of these women is safeguarded. And for people with hearing impairments, a lot of medical staff do not know how to communicate with them. They have no training. They have no training on communicating with these hearing impaired women. Carers are a very respectable job, and sometimes they cannot even go to work. So we hope the government can provide more assistance to women with disabilities. Harmonic Recreation Society, Mr. Li Wai. Thank you, Chairman. I think respite service provided by the government is very important. I want to raise an example which might not be known. Since March 2012, private respite resident providers can also provide these temporary accommodation. And how many how many places can be offered by these respite providers. Right now, these providers can provide 510 places. It's not a big number, but it's a welcome relief. The SWD arranged a consultation session, and I was invited. And the government shared their vision on the respite program. And the idea is that the respite service can be provided everywhere, anywhere in Hong Kong, and the elderly only have to pay a very small fee, a very cheap fee, so that the program can benefit everyone. Well, Chairman, I think this is such a romantic idea, but in reality, it simply doesn't work like this. And the elderly homes have not been very popular with this proposal. And there are a few reasons for these elderly homes. Their greatest workloads come from the first and second days of entry for the elderly, and there's a lot of paperwork, registration, admin work needed, and they need time to understand the needs of these elderly people, and this takes up to 2 to 6 weeks. For a lot of these elderly homes, taking care of these elderly people is a difficult job, and under the SWD's new policy, the resident providers, they care about the occupancy rate, and every day they only receive an additional $60 a day, which means $2.5 a day. This is a very difficult service to run, and the providers lack an incentive to continue with their efforts. I think the motivation behind this program is excellent. If the SWD can provide more services, it will benefit the whole of Hong Kong.
My name is Lee Shih-chen, Elderly Rights League. Good morning. I'm a chronically ill patient, so is my husband. 3 years ago, my husband used to be caring for me, but starting from last year, it was the other way around. And I am sort of a disabled person. I'm wheelchair bound. I suffer from a serious illness 3 years ago. After being discharged from the Maryknoll Hospital, I had to attend the daycare center in Yau Ma Tei. And I thought that I would be able to regain my physical ability, but that was not to be. Twice a week I had the therapy, and after 10 weeks later, I was told that that was it. And I asked them what was going to happen to me. I couldn't walk. And then I spent $1,900 on this wheelchair and the crutch for $160. And I was told to approach the daycare centers for some therapy. I couldn't walk. My husband is 85 years old, and he can't walk much, unfortunately. But he used to be able to do some cooking, and he could push me around, but he couldn't do anything like that since last year, because he was suffering from dementia, and without me accompanying him, he couldn't find his way back from the street. The only thing I like to to seek assistance for would be just the daycare center. We can go there at 9 a.m. We can come back by 3-ish in the afternoon so that we can spend some time together. But we couldn't find any center because I was told that it would be difficult for us to be in the center together. And I believe if we get separated, we can't survive because we're worried about each other. I go for medical consultation, and he would call the police for missing person. And it's a really big source of trouble. I am not collecting any CSSA. We get $1,300 for the disability, and my kids would support me for about $2,000 per month, and we have to buy some health food for our bones. We have to buy the health food to nourish our bones. I mean, this will cost us a couple of $100, and we've got no idea where to approach the funds that are available to help us. And I hope that there would be some places that they can be made available to us at the centers. All right, thanks very much, Ms. Li Shi-chen. And next, Ms. Chen Wu-jen. I am just an ordinary citizen. I don't know much about anything. I used to work for a private home for the elderly, and there are some senior citizens are being sent to these homes, and they can't bear to part with their family members. Let me tell you something about the old folks' homes. They're running short of people in these homes, and there are some senior citizens who may want to go to the toilet, and the nurses couldn't cope, and they were just left there soiling their pants. There was an old lady who took a bath every other day, and she had nothing much to eat. I mean, someone would put the breakfast on the table, and she couldn't cope with the breakfast herself. And they are severely understaffed, and they didn't have much to eat. Now, I said that old lady didn't have any breakfast, and the staff would just say, they forget it, we're going to have lunch at 12. And that old lady passed away that very day. I mean, it was really hard, distressing. It is very much a problem in the old folks' home, and I hope that there would be more people hired for these jobs. I mean, it is really a source of distress for me to see the old lady pass on like this. I don't know much about anything, but this is the stark reality that I'd like to share with you. And the government is promoting this idea of home care service. I subscribe to this idea because with family members helping them, it would be a good idea. And I hope that you would lower the threshold as much as possible. That they are looking after their sick family members, and they have to fend for themselves. Without any subsidy, how do you expect them to look after their family members? So I hope that you will lower the threshold as much as possible to benefit more people. Now, these senior citizens should have a delightful the delightful twilight years. All right, thanks very much, Ms. Chen. Next, Elderly Concern Group, Ms. Xu Shi. Chairman, my husband and I are living together. 5 years ago, my husband had 2 major operations for cancer, and he is a stoma patient, and I have to change the stoma bag and so on. I feel very, very stressed out looking after him. My husband is on CSSA. I have to look after him. And the 2 of us are living on just one CSSA amount. And my husband had to undergo laser operation for his eye. And we don't normally go out unless we go for a medical follow-up consultation. We're living on just a couple of $1,000. It is very, very tough for us. But I find it so stressful looking after him. Financially, it is so stressful as well. I mean, life is really, really tough. And I hope that the Hong Kong government would spare a thought for people like us to lighten our load. And that's all I have to say. Thank you. Madam Xu, you haven't been in Hong Kong for 7 years. Right, understood. All right, next, SOCO, Society for Community Organization, Ms. Yun Shuk Yan. Chairman, thank you. Well, the government is advocating aging in place, that there are many senior citizens who are living at home, but they don't have much of a life. Now, we meant to bring an old man here, but he has to go to the hospital for checkup. He can't make it here. He's 80-odd-year-old, and he is looking after his senior citizen, his wife, twice his size, who was also 80-something. They've been waiting for physiotherapy, but they couldn't get it. And he would take his wife to the park and try to apply the makeshift physiotherapy for her. Now, he hasn't been in Hong Kong for 7 years, so they cannot collect a CSSA, and he's working. And there is this woman who is looking after her cancer-suffering husband, Miss Li Shi-chen. She's wheelchair bound, and she's looking after this demented husband. And the condition is getting worse. But the only thing they can do is to queue up for the daycare center. And she is struggling in her wheelchair, looking after her husband. Now, these 3 cases are typical cases of senior citizens looking after the fellow senior citizens. How much does the government know about these elderly people who are looking after their elderly spouses? What sort of assistance is the government giving them? Home help service and the RCHE service, has the government done anything for them? I look forward to some reply from the administration. Come September, the CCS voucher scheme is coming on stream. We polled some grassroots elderly in Sam Shui Po, and the voucher scheme will be on a cost recovery basis. The senior citizens will have to pay for the costs, and they've got no idea what sort of service would be good for them. They are concerned that with privatization of the services, that there will be problems with the supervision of the quality of service. I hope that the government will consider the practical issue of offering some subsidies to the carers. The carers can look after the family members. Perhaps the cash can be made available to the family members as an incentive to incentivize the family members to look after the needy at home. Okay, thank you. Right, next, Lai Kok Estate Mutual Help Association, Ms. Lai Kit Wei. Chairman, I'm from Lai Kok Estate, a mutual help association. I'd like to say something about the carers and the carers allowance. I've got 3 kids myself, 1 in primary, 2 in kindergartens. My in-laws are helping out sometimes. I've got a part-time job somewhere nearby to supplement the income. to lessen the burden. But my in-laws are getting on in years, and they are liable to get sick, and sometimes they find it difficult to look after the kids. In return, I have to look after them. I am looking after 5 individuals. I have to quit my job, and I'm under tremendous pressure. I don't have any private life at all. I mean, life is very, very tough for me. One time, I was looking for help, to help with my kids because of some urgent business to attend to. And downstairs, there is this childcare center, and I was told that I have to make an application for a couple of days before my business can be attended to. And I said I've got something desperate to attend to, but no help was available. One time I attended a talk, and I was told about these childcare services and the community nanny scheme, but in 18 districts in Hong Kong, there is just one service center in each district. The quota is simply too small. The nannies have a high turnover rate, and they can't bear the tremendous responsibility looking after someone else's children. I mean, they can't even go to the market if they are child-minding for someone else, and they have to be stuck at home for 8 hours. And who would be prepared to do a job like this? So I just feel that it is tremendously stressful to be a nanny. If the government can provide a better childcare service, if the centers can be better located and the opening hours can meet the needs of the parents, it would be a good idea. And that would be true support. Don't you agree? Thank you.
Thank you, Mrs. Lee. Next up, the Changsha Wan Childcare Concern Group, Mrs. Tang Ye Mei. I'm from the Changsha Wan Childcare Concern Group, and I'm a full-time housewife, and I take care of 2 kids who are in kindergarten, and also the grandparents. Our family does not earn a lot. Sometimes we send kids to hobby classes. We have to look around for cheaper classes, and we invest a lot of all our efforts on the kids. Full-time carers do not have an easy job, and at the same time, I also have to take care of the family. Sometimes I get sick, or when the kids get sick, the mother has to do everything. Visit the market, do the washing, and basically our job is round the clock. And my husband works in construction sites, and it's a very difficult job, and sometimes I want to help and work as well. I support the idea for assistance to elderly carers, but I want to mention that carers of people with special needs and children also need support, because they are equally their job is equally difficult. Allowing the elderly people to live comfortable lives ought to be their rights. And I think it's often taken for granted that the mothers have to do everything. Somehow our society is gauging everything with money, and some people say if you don't have money, don't have kids, and even if you don't have money, don't get sick, and a lot of our basic rights seem to be exclusive to rich people. I think we cannot say that only rich people should have kids. I really hope the government can learn to other countries and take up more responsibility for carers, and especially mothers. If the mothers are given greater support, their children will grow up more happily and become better people, and this would help the society as a whole. So overall, I think the government should help the carers relieve their burdens. Thank you, Ms. Tang. And Lycaut Estate Women's Right Concern Group, Mrs. Chen. I want to talk about the assistance and subsidy to carers. Apart from elderly carers, carers of children is also very necessary, and they have a very difficult job as well. And this is more challenging than working, and because sometimes they might be accused of not taking care of their kids properly. As a mother, I hope our kids, my kids, can have better lives. And I gave up my job for my kids and became a full-time housewife. And financially, I rely on my husband, and he has a big burden, and he doesn't make much. And we have a lot of expenditure. And personally, I don't want to give my kids to. Don't want other people to take care of my kids. I'm very clear of the needs of my own daughter, and that's why I'm reluctant to allow other people to take care of my daughter. The government should give assistance to the care of children. Sham Shui Po Care Concern Group, Mrs. Feng Li Qing. Thank you, Chairman. We are a group of grassroots women. We have kids who go to school. Very small kids, toddlers. Right now, my husband goes to work, and I still live with my mother-in-law. I also want to get a job outside and get a half-day job. And I want to help the family. My kids go to school from 9 to 12. And my lives include going to the market and picking up my kids. Sometimes we have birthday parties, and we go out during holidays. There is a lack of childcare services, and the government's childcare services and it's not adequate, and a lot of the service is not known. if you have urgent personal matters, you cannot. The government's childcare services cannot help. And if you have a regular daytime job, then by the same token, these childcare services don't apply. And our suggestion is our suggestion is for the government to provide childcare services during the kids' school hours. Thank you. Hong Kong Federation of Women's Centers, Mr. Leung Shelun. We are very concerned about women as carers. Due to traditional gender division, a lot of the carers are women. According to the statistics, more than 90% of full-time carers in Hong Kong are women. As we talk about gender equality, a lot of government officials here are women. But I'm not sure if you have kids already. If you have kids, you probably have a domestic helper. However, a lot of people have to give up their jobs and take care of their families at home. We plan to have a women representative attending this meeting, but she has to accompany his family member to the doctor, so he could not make it. A lot of the times, caring work affects multiple aspects for the women, including their health, their social activities, mental pressure, social lives. We are particularly concerned about the poor women carers, the poor economic conditions. Hong Kong is a metropolitan with a very affluent city, but the support to carers are well behind of that of other countries, such as Japan or Taiwan. They have a lot of assistance for carers. But for Hong Kong, the carers have put in so much efforts, and they don't even have basic protection when they get old. And they are very anxious about this. We hope that apart from the carers assistance, we hope there's a subsidy for carers of PWDs. We hope the carers assistance we hope that the level of subsidy would be 60% of the minimum wage level, and this would come to $3,430. And I hope the government will provide better community supports. Thank you. Ms. Sarah Pemberton from the Lion Rock Institute. Hong Kong has about 150,000 carers. These non-organization carers, 70% of these carers feel that the government is not providing enough supports to them. We have put in a lot of resources and time, but the situation has not got any improvements. If we only try to patch up the current policy, the problem will only get worse. With rapid population aging, we must come up with a complete solution to the carers. The government should regularize and monitor and encourage more organizations to provide caring services. And the government can introduce in competition, which would only improve the service quality of these caring organizations. The government should give the rights, give choices to recipients who require caring services, and the recipients can choose their own service providers, prices, time, and date, etc. And this would give greater freedom to the recipients and improve overall service quality. And there are three benefits to these proposals. First, and we can promote a free market in the business of caring institutes. And second, we can actually help the people in need, and without having to go through the respective government authorities, because it will be a waste of time. And thirdly, we can minimize non-essential costs by the government, because the services can reach out to the needy people directly.
Right, next, Mr. Chiu-hung, Hong Kong Women Workers Association. Chairman, thank you. In the community, looking after senior citizens and children or people with particular needs would be a responsibility for women. In Hong Kong, the government hasn't provided enough support to these women. If you're well off enough, you can hire carers, but without any means, you have to shoulder the responsibility, and the responsibilities that would normally fall on the women. We are particularly concerned about child care. Of 5 children, 1 would be from poor family. The family members simply cannot afford any carers. But as far as we know, of 610,000 children from 0 to 3, only 10,000 would be able to afford the care, the hired care. Now, when the women are looking after their own family members, they have to get a job on the side to supplement the income, and they have no option but to find some casual work, work that doesn't offer them any reliability. And they cannot pursue their own life. They don't have much of a social life at all. Now, if you hire a carer, then you have to pay for her. But if you're looking after your own family members, then you don't get any subsidy at all. A lot of women are acting as carers for free, and they're making tremendous contribution to society. And I feel that the government should offer them some kind of allowance. Now, there may be a carers allowance for those looking after the senior citizens. I don't think we should make a distinction between the senior citizens, the children, and the needy. I think for all the carers, if they are from the grassroots, they should be entitled to some kind of carer's allowance, and that would give them that much more protection. All right, thanks very much, Mr. Z. Thank you so much, the 20-odd deputations who have already spoken. There have been a lot of views expressed regarding carers' allowance for looking after the disabled and the senior citizens. The Salvation Army, the other NGOs have been advocating that for some considerable time, and people are experiencing tremendous difficulties with home care service, the daycare service. The opening hours are not really good enough. There are old couples who are looking after themselves. Old lady, Miss Li Shi-chen, she's looking after her elderly spouse. He's sitting right behind her. He is suffering from dementia. A couple of years ago, her husband was looking after her. I mean, now the table has been turned, and there are some who simply cannot fend for themselves, like Madam Xu Toshi. She hasn't been in Hong Kong for 7 years, but her husband is suffering from cancer and dementia, and both of them are living on one single CSSA payment. And this is wholly inhumane. And perhaps I'd like to hand the floor over to the administration for some response before we have some discussions. Mrs. Chen or Commissioner Siu? Mrs. Chen, please. Chairman, thank you. A moment ago, I heard from the deputations, in particular some senior citizens who relate their own stories. Now, for individual cases, they are unique in their own right. It would be difficult for me to elaborate, like why this old lady cannot get this or that kind of service. Overall, let me say this. As I said at the very beginning, we started this aging at home scheme, and the package of measures would be important. We're suffering from aging population, and it is a commonplace for old people to look after their old spouses, and this is something that we have to face up to. When we promote aging at home, first of all, within the past couple of years, we have devoted a lot more resources to increase the home care service quota. We have increased 2,000 places for the home care services. Now, the waiting time has been shortened. Obviously, we are aware that the situation may differ from district to district, but waiting time has been shortened for sure. Even if we have increased the quota, we understand that there is still a keen demand for community care. There is so much that we can improve on. So, other than the conventional community care, we are looking at new ways to promote aging in place. So we're going to be launching the CCS voucher scheme. And as some deputations mentioned, we'd like to have this idea of money follows the users, and they can, with this amount of money, choose the services that suit them the most. And the market can be more diversified, and there will be greater flexibility in the provision of services for the elderly. A few moments ago, there were some deputations mentioning the carers' allowance for those looking after the PWDs and the senior citizens. And we will take this away with us. Now, there were mentions to the respite services. I think that there might have been some misunderstanding somewhere along the line. Perhaps I defer to my colleagues for further details. Right, Chairman, about the respite service. Now, it was said that if there can be daytime respite service, it would be good. So, starting from last year, we've extended this to the board place scheme. Now, in these board place homes, the response is not particularly keen. These senior citizens, they have to be subject to some assessment, and the occupancy rate is not particularly high. Now last year, let's take the second half for instance, about 200 senior citizens have used the respite services in these board place homes. Now, there are daycare centers and also the neighborhood centers that have made a referral, and I hope that this would be convenient enough for the carers. And honestly, this is not because of the vacancy in the board place homes, because these occasional vacancies are bound to happen. It is impossible for the homes to be 100% occupied. There may be senior citizens who have passed on, who are hospitalized. It would be some time before the places would be filled. And I hope that this respite residential service would be of help to the carers. Chairman, if I may move on to the other point mentioned by the deputations, they are concerned about the CCS voucher scheme, and they are concerned about the idea of being made to pay more if they can afford, and they are concerned whether they would be able to afford the CCS voucher scheme. Now, you don't have to be worried about it, because we do conduct a means test, and the minimum payment would be only $500, and this can be recouped from the CSSA to the tune of $150 or $250. There is no question of anybody not being able to benefit from the CCS voucher scheme, when in fact, if those who can afford will pay more, then we would have more resources available for the needy. The CCS voucher scheme will provide 800 daytime places. With the introduction of this voucher scheme, what I heard from Madam Xu and Madam Lee about their needs, perhaps after the meeting I'll get in touch with these two old ladies to see whether we can make a suitable arrangement for them. Right, this subcommittee will be following up on the CCS voucher scheme. There would be more opportunity for you to express your views before its formal inception. There are concerns about the respite care for the disabled children. Commissioner Siu, thanks very much, Chairman. Once again, my thanks to all the carers. I must stress once again that we do recognize your contribution, and you have made a lot of comments regarding the daycare service. I'm sure that the service providers will earnestly consider your views with a view to making improvements. Perhaps I'd like to highlight a couple of points for response. The first one is the respite service. Later on, the SWD will be liaising with the service providers about the specific details. I must emphasize that this respite service for the 12-year-olds will continue. Well, not only are we extending the existing service, we're aware that this respite service would be very important to the carers of the PWDs, because this would bring about some relief for them. Not only are we seeking to extend the service, we will be seeking additional services to increase the quota. Second, a moment ago, you mentioned the carers allowance. They also mentioned the financial support. I think it should be a dual-track approach. The support service and the financial support should proceed in tandem. Now, we will continue with improvement in the support services. Now, we do have the respite service for the home care service for the people with severe physical disability. The response has been pretty good. As I said, we're going to be regularizing this and extending this to all 18 districts in Hong Kong. Depending on the needs, we can enhance the service, and we will certainly enhance the service in this particular area. Financial support. The financial support for the disabled is also important. Other than the disability allowance and the CSSA, the CCF, Community Care Fund, also offers assistance to address the particular needs of the disabled. That's why we have this caring allowance of $2,000. There will be an additional $2,000, $2,005 for the respiratory support. The SWD and the HA are looking at a case management system to look after these people with severe disabilities and see how we can regularize the support. So we will be offering service support and financial support. I am glad to hear from the associations regarding the carers allowance, and we do keep our options open in this regard, and we monitor the development going forward. And there was a mention of the people with intellectual disability getting older, and we are seeking improvement in different areas. In 2010, for these severely intellectual disability homes and mildly disabled, we have increased the manpower. In 2013 to 14. We have earmarked to $20 million to enhance the services in the centers with a higher number of people with intellectual disability. In the long run, at the Rehabilitation Advisory Committee, we have a working group set up which is looking at the healthcare and the community care and so on, in order to identify short-term, medium, and long-term solutions. And we're seeking resources to get this done. We are equally concerned about this. For others, we have given the undertaking that we will be liaising with various organizations with a view to identifying solutions. Thank you.
Thank you. We have a session, a second session. We have overrun a little bit for the first session. Let me draw a line. We have 3 questions, and each member will have 3 minutes. Mr. Tam Yu-chung. Every year, the DAB has made requests to the government to provide a household assistance of $1,000 for families with persons with disabilities to help with their lives and their spending and to relieve their financial burden. Other support services are also necessary. Just now, the administration has responded to calls for more support for these carers, and I hope the government can do some solid work and not just pay lip service. Now, today, a lot of groups have voiced their opinion. And I also recognize that there's a lack of manpower in a lot of elderly homes. So can the government consider introducing more professional helpers? If we have elderly homes but don't have enough people, don't have enough staff to support the elderly homes, it's still useless. We need to think about local recruitment, or if necessary, and we have to import these manpower from elsewhere. If our elderly people do not receive adequate support, this is an unacceptable situation. These are my points, and no answer is needed. Mr. Chang Kwok-chu. Now we already have so many groups in the first session. I feel very sad about this situation. I think the government is aware of the situation, and the problem is our services are inadequate. On private respite service, I think the government can should respond. Whether they only receive $60 a day, and if I'm one of those private service providers, I would rather not provide such service because the money I get is so little. Just now, the rehab commissioner said the respite service would be extended to all 18 districts. What's the timetable on this? The documents talked about carers allowance, but it only focused on elderly carers and not carers of persons with disabilities. It just says the government will study the possibility, but it only covers carers of the elderly people and not carers of PWDs. Yesterday, together with the chairman, I met some elderly people. If they want to request some home services, they have to do it in a bundled manner. If they, for example, if they need household cleaning services, they have to apply for meal delivery services as well. Is this a requirement of the SWD and the respective organizations? Some organizations said that it's a problem of rationing, and because the amounts of services provided is uneven. Let me say something about respite service. Respite services in private providers and other elderly homes charged the same. It's all $60 a day. It's the same for both place homes and contractual service providers. And the respite residential places are subsidized by the government. And the LegCo might not be very clear about the use of respite residential places at board place homes. So let me say something about it. And these are community service provided. And people can call up these service providers and see if there are any vacancies. From September to December last year, over 100 elderly persons were entered into board place homes. From July to September, we had over 100 elderly people entering into these board place homes with available places. The district personnel and organizations are aware of this service. Can you provide usage statistics at board place homes in and also private resident providers? And the carers allowance obviously only cover carers of elderly people and not carers of persons with disabilities. And regarding the bundled home care services, Mr. Siu, the pilot scheme will be regularized in March 2014. As you can see from section 19 of the document, the carers allowance is still in its early phase, but we are very open to suggestions. As I said, the elderly carers allowance is still in its initial phase, and we don't have confirmed details yet. Ms. Lee. We mentioned in the last meeting, for home care services, we never said it has to be bundled. Demand for integrated home care services is very, very big, and if a particular elderly person requires escort service to see the doctor, they need to apply for other services as well, because it's an integrated service. So the authorities cannot just provide somebody to escort the elderly person to the doctor. I think you need to look at the arrangements of this integrated service. Mr. Poon Siu Ping. Just now, the Secretary talked about respite service. Some friends here talked about expanding the opening hours. Can this be done as soon as possible? And on the pilot scheme for carers, carers of elderly people, the arrangements for elderly carers taken care of by the community care fund. And the government said they are open on this issue. My worry is that the government does not have a clear direction. What is the progress of the measure? Mrs. Chen. Thank you, Chairman. Let me talk about the carers allowance. The elderly carers allowance. This is unprecedented in Hong Kong. We do not yet have the experience. We have similar programs in other countries, but we have to look at how we implement this allowance scheme in Hong Kong. Because this allowance plays an important role in terms of our overall strategy of aging in place. And that's why we are running a pilot scheme, and we want to test drive it and see if they can be extended to all districts. We will study this allowance scheme in another subcommittee. At this point, we do not have a decision yet on how on the details of the scheme. And on the respite service hours, for daytime services, it's a response to the demand of the elderly people, because a lot of them need daycare services. In the new budgets, we will open a new center, and we will have extended working hours to offer the services until 8 p.m. at night, and it will even be open on Saturdays and Sundays. And we will study whether this new measure can be extended to other daycare centers. We hope this can be done in all centers and not just new facilities. And some groups mentioned supports services in Tung Chung because the current support is very limited. Can you respond on this issue? Ms. Lam, we are aware that in Tung Chung or other more remote districts, we face difficulty. We are very open on this. If we can if we can rent private properties, we can offer such services. For our resource center, we are yet to identify a permanent site. So at the moment, we are renting private premises. I have been to that center. We're talking about commercial facility, and it's not a suitable site for a resource center. What arrangements do we have?
I heard some suggestions from the NGOs. We see how we can rent the suitable places. Perhaps we can liaise with the LCSD to use some of the venues there. We follow up on the feasibility there. All right. Because of the time constraint, we cannot go on any further. We're running a little bit late. We can't take too long a break. Let's come back at 12:55. Thank you all very much for coming.